today my topic is going to be on colon cancer. It is Colon Cancer Awareness Month, March. It also is Women's Awareness Month. So we're going to start off today with colorectal cancer. So what is colorectal cancer? Colorectal cancer is a disease in which cells in the colon or rectum grows out of control. Sometimes it is called colon cancer for short. The colon is a large intestine or large bowel. The rectum is the passageway that connects the colon to your anus. And this is just photographs of what your colon looks like. What are some of the symptoms of colorectal cancer? A change in bowel habits, blood in or in your stool, diarrhea, constipation, or feeling that the bowel does not empty all the way, not just one time, more than once. Abdominal pain, aches, or cramps that don't go away. Weight loss, and you don't know why. Some people, they lose their appetite. They have persistent lethargy or tiredness. And some people may look pale or even jaundiced at times. So what are some of the risk factors? It's believed for quite some time that being older is also a risk factor. Personal and family history, race, African-American men and women are at high risk. Being overweight or obese, inflammatory bowel disease, not being physically active, alcohol use, smoking, diets high in red meats and processed meats. So what do we do if we suspect colon cancer, or what are some of the things that doctors do nowadays to ensure that we're monitoring people closely? They do colorectal screening. The U.S. Preventative Services Task Force that says that adults aged 45 to 75 be screened for colorectal cancer. The decision to be screened between ages 76 and 85 should be made on an individual basis. If you're older than 75, talk to your doctor about screening. People at increased risk of getting colorectal cancer should talk to their doctors about it regardless. So let's talk about some of the screening tests that are done. They may do what's called a colonoscopy. They may do a biopsy while they're doing the colonoscopy, a CT or CAT scan, ultrasound, gene and protein test. Other tests such as MRI, X-rays, and blood tests may also be done to look at how big the cancer is and whether it has spread. So what happens if someone gets diagnosed with colorectal cancer? If someone has colon or rectal cancer, treatment depends on which type of cancer it is, how big it is, and whether it has spread. Treatment may include surgery, radiation, chemotherapy, targeted therapy, or immunotherapy. Many people get more than one type of treatment. It is important that the person speak openly to their doctor and ask questions if you don't understand something. Some questions you may ask: what are the stages? What type? And what treatment do you think it would work best? And I always tell patients to practice asking, if that was your loved one getting this diagnosis, what would you recommend? So what are the common types of colon cancer? The vast majority of colon cancer is a type called adenocarcinoma. This is a cancer of the cells that line the inside surface of the colon. Rarer tumor types include carcinoid tumors, gastrointestinal stromal tumors, and lymphoma, which is a cancer of the immune system that more commonly starts in the lymph nodes, but can also start in the colon. So what are the different stages? Stages describe how widespread the cancer is in the colon and whether it has spread, metastasized to other organs. This is crucial information, and this is information that I received from a hospital that is in New York, Sloan Kettering. They tailor their care plan specifically to their patients. So the 5 stages are: stage 0, the early cancer is found; stage 1, then you have stage 2, stage 3, and stage 4. And this is what that looks like, the different stages. To my far left, you're right, the stage 0 is here, so you really just see a small amount. Stage 1, it gets bigger. Stage 2, stage 3, and this is when it has gone to stage 4 and is now spread. Common colon cancer treatments I already discussed earlier: polyp removal, chemotherapy, surgery, and metastasis measures. Here are some ways that you may lower your risk of colorectal cancer. Research shows that habits related to diet, weight, and exercise are strongly linked to colorectal cancer risk. Changing some of these lifestyle habits may be hard, but making the changes can also lower the risk for many other types of cancer. You want to get screened for colorectal cancer, eat lots of vegetables, fruits, and whole grains, get regular exercise, take control of your weight, don't smoke, and avoid alcohol. What foods reduce your risk of colon cancer? Diets high in inflammatory foods such as white bread and sugary snacks have been linked to heightened risk of colon cancer. Colorful fruits. Most fruits are excellent sources of fiber, antioxidants, and phytochemicals, all of which can reduce the risk of digestive issues and colon cancer. Some healthy, delicious choices include apples, berries, cantaloupes, mangoes, oranges, and pears. Fresh fish. Certain types of fish, such as herring, mackerel, salmon, sardines, and tuna, are high in omega-3 fatty acids, which can help reduce inflammation throughout the body. White meats. A sufficient amount of protein is essential for muscle development and tissue growth. However, red and processed meats such as beef, pork, lamb, hot dogs, pepperoni, and cold cuts have been directly linked to an increased risk of colon cancer. Healthier alternatives include white meats such as skinless chicken and turkey and eggs. Other foods, beans and legumes, whole grains, nuts, non-starchy vegetables. It's best to focus on non-starchy vegetables such as artichokes, broccoli, cabbage, carrots, cauliflower, celery, cucumber, kale, lettuce, and spinach. Now, here's some surprising things that we're finding out lately. Colorectal cancer rates in younger people have now surged in the recent years. More troubling, most cases diagnosed are at an advanced stage, and researchers aren't sure what's causing the cancers. According to new statistics from the American Cancer Society, the proportion of colorectal cancer that occurred in people under age 55 have doubled between 1995 and 2019 from 11% to 20%. That means that of the roughly 1.3 million people only in the United States living with colorectal cancer, U.S. states from 2019, about 273,800 were younger than age 55. People born after 1950, the millennials and Gen Zers, are twice as likely to be diagnosed with colon cancer and fourfold more likely to get rectal cancer compared to people born in 1950. A 2017 study published in the Journal of the National Cancer Institute have found. The numbers are climbing at an alarming rate. A study published in 2021 in JMA estimated that it is just 7 years colorectal cancer. In just 7 years, colorectal cancer will be the leading cause of cancer deaths in people ages 20 to 49. And that is alarming. Here's some other numbers that we had believed for quite some time. 50 plus ages strikes 101,000 of people in 2019. What are some of the statistics in places like Canada? It is estimated that about 1 in 16 Canadian men will develop colorectal cancer, and 1 in 19 Canadian women will also develop colon cancer. In Jamaica, colorectal cancer is the third leading cancer incidence and mortality among males as well as females. So things to remember: colorectal cancer is the third most common cancer diagnosed both in men and women. Your risk factors are your age, certain disease, your diet, lack of exercise, smoking, alcohol use, and genetics. And you can get genetic testing as well. Support groups that are available if someone should be diagnosed with colon cancer: the Colorectal Cancer Alliance, the United Ostomy Association, UCSF Health, MD Anderson Cancer Center, Memorial Sloan Kettering, and Edward Health. These are all institutions that you can go online and search as well. I want to give special acknowledgement to the CDC, Memorial Sloan Kettering, American Cancer Society, South Lake General Surgery, Health Central, Halifax Health, Canadian Cancer Society, and the Cleveland Clinic. I thank you so much for your time and attention. I hope this was helpful. Should you have any questions, you can feel free to join me in the Zoom, and I'll be happy to answer those questions for you. Thank you so much. God bless, and have a wonderful rest of the day.